everyone! I am here today to tell you a story of triumph, a story of struggle, a story about doctors. Recently I had a health scare, which turned out fine. Don't worry, I'm fine, I'm living, I'm breathing. But one of the aspects of this health scare brought me to an infectious disease specialist only so he could read my blood works. But I have to tell you, the infectious disease specialist's office was the weirdest place ever. My focus was pulled to the girl behind the counter. Now, to be fair, I would not want to be the person behind the counter at an infectious disease specialist, but this poor woman. This poor woman has got to be the most paranoid doctor's office attendant person that I have ever borne witness to. Now, as I said before, I cannot say that I would want to be the one dealing with the infectious people, but I swear, if this woman could live her entire existence in a giant condom, that would probably really suit her. Normal doctor's offices, they hand you your paperwork and you just take it from them. Not this woman. Oh no. This right here is your paperwork. Thank you. Thank you. No. Thanks. That's right. This woman will not come close enough to your hands to hand you a piece of paper. I have never had anyone take my vitals while wearing a pair of rubber gloves and a full face mask before. Ever so often, when sitting in this waiting room, and trust me, this is not a busy waiting room, one can see this lady wiping down everything behind the counter. She wipes down the surface, and then she wipes down her keyboard, and then she wipes down her monitor, and then she wipes down, especially, she wipes down the pens and pencils that get handed to you when you fill out your patient paperwork. You know what's a little bit of a downer? Is all the flyers about infectious diseases. Now, I have never understood why doctors' offices feel the need to scare their patients. It's awful. Okay, so I know these things exist, and I know that I am eligible to have them, which is terrifying. But I don't need a picture on the flyer. Can't we just have the name displayed, like with bubbles or something happy, like something that's not infectious? But no, we have to have a close-up, a very close close-up on what exactly this disease looks like, so that I can freak myself out. I have that! Oh my god, I totally have that. I have that. What if I have that? Oh, I don't have that now, but what if I get it from the waiting room? Oh my god, don't touch anything. Oh, and before I know it, I'm as bad as the woman behind the counter. The real kicker of this whole doctor's office was the little bowl of candy. Yes, candy. Sitting on the counter. Right between the flyer about HIV and the flyer about chlamydia. It's a bowl of candy. I don't think anyone in their right mind would take candy from an infectious disease specialist's office. If you're taking that candy, you clearly have a bigger problem than an infectious disease. It's almost worse than taking candy when they throw it at the parades and it lands on the sidewalk where you see all those guys spitting and you know all the drunk people have puked and everybody walks by with their disgusting shoes and steps on the sidewalk and then they throw candy on the sidewalk and you pick it up and put it in your mouth. And the best part about the particular kind of candy that they had at the infectious disease specialist was that it was Dum-Dums. Now, if anybody knows what a Dum-Dum is, it's like a kind of lollipop. They're not sealed. They're not at all sealed. The part that you put in your mouth is wrapped, not sealed, in a thin layer of paper. A thin layer that germs could easily creep beneath. Of all that poor behind-the-desk lady's jobs, I should think that refilling the candy bowl is probably not one that she does very often. And since the end result of this story was a doctor telling me that I don't have cancer, I think it is a happy story. Thanks for watching, as always. Toodle-pip. Holy shit, this stuff burns. Oh my god. Wow. Wow, ouch, I need to wash my hands. Ow, ow, ow.